Dr. Danenberg, who is a periodontist, gum specialist, also a functional medicine practitioner. Has written what, 3 books?
Well, basically, I've written the only book that I'm really proud of right now is Crazy Good Living. So that's the most recent.
Really?
Yeah.
Well,
The other books go way, way, way back in my other life. So,
I really, really enjoy your book.
Thank you.
And I refer to, I have my collection of books. I'm kind of a book junkie, and that's top of the list. But anyway, so Dr. Danenberg and I have been conversing quite a while about how we could bring a little more working knowledge to everybody about dentistry, oral health, or biome, oral biome. So as we posted before, as I posted before, asking for questions, things like mercury in fillings, toothpaste, etc. So today, just kind of want to talk a little bit to you guys about what we're going to do, and about Dr. Danenberg and his incurable disease diagnosis and how he's handling that. But also kind of get this started. I hope to do this every week or every now and then, and we'll just keep it to like 20 minutes or half hour, if that's okay with you, Doc. And
perfect for me.
Perfect for you. Wonderful. I do have some slides I can attach later because this is a new program, so I'm trying to figure it all out. But there'll be a way in the future when I could actually put slides up as we go. Yeah, they can hear you. Excellent. So how did you get into functional medicine? I guess that's a good place to start.
Well, that goes way back. So things have happened to me in my life, So at the age of 59, I had a stroke, crazy enough as it is. Conventional medicine wanted to do certain things to help me survive, and they put me on 7 medicines. I didn't like the idea. And eventually I learned about a more sustainable lifestyle and diet, basically a primal diet, primal lifestyle, changed my eating habits to much more clean, got rid of all processed foods, basically got rid of the Western standard American diet. And slowly, because my body was improving, weaned off of all medications completely. And by the age of 71, I was feeling pretty healthy. 70, 71, no meds, dropped 30 pounds. I mean, things were great. Something happened a long time ago, but something happened at the age of 71 when I started to notice some interesting soreness in my chest. Like I bruised a rib. And we can lead on to what I'm dealing with now. But once I learned about a healthier nutrition 6+ years ago, I started to get more educated. And that's when I got the certification in functional medicine, as well as a primal health coach and a few other things.
All right, so that was a stroke at 59. How old are you now? You're 70?
72.
72. Oh, that was quite a few years ago. And so the stroke, did it leave any deficits or any?
No, it was perfect. They saved my life. They did modern medical miracles, saved my life. I was back to work in about 30 to 60 days. No numbness, no lack of muscular function anywhere. So I was pretty lucky, but I thought that I was doing well, but I didn't know how poorly I was doing until I learned about a functional lifestyle and functional diet. Primal lifestyle and primal diet.
So I from what I understand, a lot of people that enter into functional medicine, something like what happened to you or happened to me, creeps in there and you begin to question things.
Right. Right, because conventional medicine doesn't give you the answers. They're great at dealing with emergencies. They're great with dealing with acute disease. I wouldn't have it any other way, but they're not very good at looking at what's causing a disease or helping to prevent it. They basically, as you know, conventional medicine treats the symptoms, the manifestations of disease. They don't uncover the underlying causes. So I'm very inquisitive. So I needed to get answers. I couldn't get it from the medical profession. So I did quite a bit of searching, and eventually I learned to be a functional medicine practitioner as well as a primal health coach, and got more certifications along the way.
A lot of certifications, yeah. And what point did you write your book?
So the book, I think, was published in 2017. So it's about 2 years old now.
Okay, very relevant. So, and you practice periodontics as a periodontist for how many years? These
44 years. Yeah, 44 years,
years.
a long time. My
So,
God, I'm a relic.
Not quite, but anyways. So let's talk a little bit. Let's bring something to the table for the viewers. Let's talk about dentrifices and toothpaste and mouthwash, and then the next time perhaps we could talk a little bit more about your journey and what you're dealing with.
Sure, absolutely. The sad thing is, we're inundated with the products that major pharma wants to throw at us, and we're thinking we need this, or else we don't get the right toothpaste or the right toothbrush or the right mouthwash. We're going to have bacteria that's going to damage our mouth, damage our gut, damage our immune system, damage our whole body. And that's just not true. Now, we can get into what I think is really causing chronic disease, which periodontal disease and tooth decay are part of, but it's not the toothpaste, and it's not the brushing and flossing, although those are important. Toothpaste is irrelevant in maintaining a healthy mouth. Let's say you want to clean your mouth, which is good, obviously. You want to clean your body by taking a shower, but you don't want to take a shower with chemicals that are going to destroy the entire microbiome of your skin. You just want to remove excess bacteria and dead cells on your skin when you wash, so that your body's surface area can restore its natural microbiome and you survive. Now, when you clean your mouth, most of the bacteria in your mouth, if you're healthy, are in a state of balance, a state of homeostasis. You do not want to kill this bacteria in your mouth. You don't want to use toothpaste that have the ability to be antimicrobial. You don't want to destroy healthy dental plaque. You don't want to destroy bacteria that individually may be pathogenic, but in their environment in your mouth, if you have a healthy mouth, are in balance. Because when you destroy any bacteria, other bacteria will overcome. And those that may be commensal actually become pathologic. So when you're cleaning your mouth, you want to clean it to remove excess bacteria, just like you would clean your body with soap and water or whatever, and a wash rag, but not something that's going to sterilize your skin. So you brush, and you can brush with water. Toothpaste is totally unnecessary.
Because unnecessary. I'm glad you repeated that, because I wanted people to hear that toothpaste is unnecessary, because that's a paradigm shift in thinking for most.
Yes,
and it was for me, right? But you said something that's very interesting. You want to, it's irrelevant, but you said also that the toothpaste can act as an antibacterial, which is going to possibly harm you by disrupting the biome. There are certain things in toothpaste like sodium lauryl sulfate, like xylitol, like the list goes on and on. There's so much in toothpaste that I don't know how they get away with it. Most notably is Colgate Total with triclosan, which
correct.
So
it's a terrible chemical.
So how do these? So what you're saying then? I'm being the devil's advocate here. So these chemicals destroy all bacteria indiscriminately, right?
Well, they probably have more destructive nature to certain others than what else is in your mouth. However, you don't want to destroy the balance, period. You don't want to change the natural balance. Your balance of bacteria, you may have 700 species of bacteria in your mouth. You may have several thousands of species of bacteria in your gut. Your uniqueness is like your fingerprint, and their composition and their disposition, some that you have, some that you don't, are necessary for your health. My bacteria in my mouth or my bacteria in my gut may be very harmful for you, but it's in balance for me. And these chemicals can be destructive. And I do want to make the comment that dentistry generally is really emphasizing the removal of dental plaque, thinking that we need to scrub this unhealthy biofilm off the teeth all the time. They use chemicals that prevent certain types of substances that attach to the tooth root to begin the formation of dental plaque. Well, dental plaque is beneficial. It's one of the healthy biofilms until it's not healthy. And when it is healthy, it does several things. It actually incorporates, it is incorporated by many bacteria, up to maybe 700. Everybody's a little different. And these bacteria create their own hydrogen peroxide cocktail that literally destroys other potential pathogens that want to enter the gum tooth surface. So it is going to prevent disease. It also maintains a healthy pH, an acid level, so it doesn't demineralize the root surface. And in addition, it's like the gatekeeper to allow the minerals from your saliva to incorporate into the dental plaque, which then kind of doles these minerals out to the surface of the root to remineralize the tooth if necessary. So dental plaque is very, very healthy. Now, it can change, and it can change mainly because we're destroying it from certain toothpaste and or mouthwashes, or certain things that change the bacteria in the gut. The gut is really the critical factor. When you change the bacteria in the gut, and all types of things happen when that occurs, inflammation, breakdown of the barrier epithelial lining, the mucus layer breaks down, the immune system gets triggered, a host of cascading events occur. The mucosal tissues in your body communicate one to one another. It's called crosstalk. And the bacteria communicate. And all that change will affect the bacteria in your mouth, creating a dysbiosis or an unbalance. And now you develop pathogenic plaque on top of healthy plaque. And so then you may be feeding the bacteria with bad foods that are going to feed the pathogenic bacteria even more. And then you get disease in the mouth.
So just to review, to kind of unpack it all for everybody. So we take a relatively healthy mouth and you have plaque. So you throw in these chemicals to destroy. And on top of that all, perhaps we have an unhealthy diet. So now we've already skewed our biome to probably a more pathogenic one. So now we've destroyed everything. We can't control what regrows. So what regrows could be the bad bacteria.
Right, because your host resistance has changed, because your immune system has changed. So your natural ability to maintain homeostasis is breaking down. And then there are genetic factors that allow this to either happen faster or not as much. But once we start a breakdown process, it snowballs. It becomes a vicious cycle. And then the bacteria in the mouth, if they're active enough pathologically, and we're feeding them pathologically with foods, they start to break down the gum tissue, enter the bloodstream, enter the lymph fluids, enter the nerve sheaths, and then begin to become systemic. So you have a source or a nidus of infection in the mouth, creating all kinds of chronic diseases, including cardiovascular disease. But the main source is in the gut. So if you treat the mouth and you don't even know what's going in the gut, you'll never treat these sources completely. If you treat the gut and never treat this disease that has already manifested in the mouth, you'll never still be able to treat these chronic diseases. You have to get all the chronic nituses of infection out of activity in any mucous tissue. It could be in your lungs. It could be in any mucosal tissue.
So when we say treating the gut, we're talking about like more of a paleo type diet, including positive probiotics.
Well, but definitely a clean diet. So we don't want the processed foods with inorganic food products. The foods that are contaminated with pesticides and herbicides and a variety of chemicals damaging the gut. And we don't want foods that are inflammatory. The Wallace Protocol is a phenomenal diet, for everything, because it treats the gut.
So just to make sure I understand and kind of unpacking things for everybody, including myself. So you can't really separate the oral biome from the gut biome, the systemic biome. Everything's part and parcel. Everything communicates.
Correct. And I do want to make one point here. Yes. And a lot of people suggest that you're eating so much bacteria in the foods and whatever, and you're swallowing them, and they're getting into the gut to create gut dysbiosis.
Right.
That is probably close to 100% incorrect.
Okay.
Your body has various defense mechanisms. If we were to eat foods that have bacteria and potential pathogens, and it would get into our gut immediately, we would be dead before we were 2 days old.
Mm-hmm.
So we have the stomach acid, which is a pH of 1 or close to that, in a natural state to do a variety of things. But one of the things it does is to destroy, literally, pathological bacteria. Some get through, but 95% don't. And then your body's immune system can function naturally. But when you're swallowing bacteria, the idea that all that bacteria is getting into your gut alive is completely incorrect. And it gives the impression that you have to have a sterile environment in your mouth or else you'll be diseased. And that's not true. You want a balanced microbiome in your mouth.
When I talk to my wife and I try to explain this, or even the people I coach, there's no other orifice of our body that we clean like that. We don't put chemicals in our nose or our ears or our anus or vaginas.
Right. And if we did, we would disturb the balance.
We would destroy. So this whole idea of what we're doing in the mouth is, once I took a step back and looked at it, I'm like, this is unbelievable. This is horrible. So, doctor, it goes beyond bacteria, right? There's lipopolysaccharides, there's bacterial byproducts, the exotoxins that get pushed in the bloodstream, or perhaps leaky gut, leaky mouth, or more permeability, mucosal permeability. Is that where we also have to consider?
Absolutely. It's a very complex process. We're only slowly beginning to understand this process. So much research is on the gut microbiome today. And medicine is not new, but none of this is new either. It's just that we're becoming more familiar with the complexity of the gut as well as its influence throughout the entire body and it's the critical nature of it.
So just to review, the whole idea of this, what I call slash and burn, right? Like if the rainforest, that's what's happening now, they go and just kill everything.
Right.
So we do that in the mouth, right? I think that's Kirkola's coined that he coined. So, and he also talks about fostering this organic garden. So just like if had a garden in our yard, we're not really trying to kill anything. We're just trying to foster growth.
That would be my impression from all the research that I have participated in and read. That is what makes sense today. Tomorrow, there may be another story that makes more sense. Right now, that is the story that makes sense to me. That's what the research that is done in so many laboratories and hospitals and all kinds of environments are pointing to, or is pointing to, and that is we need to maintain balance. We don't want to just kill bacteria. We want to do what is causing the bacteria to become damaged, to remove that causative factor. We want to peel that onion layer all the way down to get the initial cause and start there. We still have to maintain a healthy environment. We have to maintain a healthy mouth. If you have disease, you may need to treat it in an acute therapeutic way. You may need to use antimicrobials to get such a tremendous amount of pathological bacteria under control, but you're going to kill good bacteria as a temporary week to 10-day type of regimen. Yes.
I want to ask you how we clean them up, but I just want to throw some stats out there for people just to understand the gravity. I mean, the one research paper I just read is if you rinse your mouth out with a mouthwash like Listerine every day, you increase your chance of developing adult onset diabetes by 70%. These are just numbers that just they're earth shaking to me. The negative effects of xylitol, the negative effects of triclosan. I mean, they even found triclosan in the breasts. Like it just never goes away. It's not bio.
I understand that the half-life is very, very long. Yeah.
And so they haven't done a total causative, but they definitely associate it with breast cancer. As with, and we could go and talk about fluoride and what it happens to your brain and neurodegeneration is proven by a study done, I think it was Harvard, in which they reviewed, I think, 27 studies. And because at first China came out with this idea that fluoride does this, and we saw that's nonsense. So then Harvard went and looked at studies like, oh yeah, it's true. And so I just think it needs to be screened from a rooftop, because if we're following the Rose Wallace protocol and we're doing all these things right, but we're ignoring the mouth and we're using the Listerine and
right. It's the insults. It's like splinters that you're not even aware are piercing your body. You need to get rid of all the causative factors, which we don't even know completely that grouping, but we do know some of them, and we need to get rid of those. And it basically boils down to all these chemicals that are in our environment that we use on a regular basis because we think they're better, or they make us smell better, or they stop up our pores so that we don't sweat now. We're changing the way our bodies were designed to function, and something's got to go awry if you're changing the biological functioning of the body.
Just to bring more gravity to it. So I read another paper the other day that, directly begin to hint in a causal of Alzheimer's, the oral inflammation of P. gingivalis, or, what have you. So what you're saying then is by altering this bacterial garden that we can actually be causing inflammation, making things worse.
Correct. Because you're changing its ability to maintain health, which would be a non-inflammatory state. So if you're developing pathological strains of bacteria and creating inflammation because they are generating endotoxins, they're generating destructive cytokines, they're generating a variety of biological processes that destroy the soft tissue, destroy the bone, penetrate the different fluid systems of the body, and then they progress. All of a sudden, you have chronic disease, and all kinds of chronic, and all types of manifestations of the disease are related to what's going on in the mouth, which is just the manifestation of what's going on in the gut. We never can say, in my opinion, that the gut is the causative factor unless you look at the ultimate what's causing the mouth problem, and I believe that it's the gut. And I'm doing some actual studies, clinical study right now in clinical trial, went through the Institutional Review Board a year or so ago, and we're trying to evaluate spore-based probiotics and vitamin K2 and how it helps the oral microbiome, how it helps the mitochondrial function, how it helps to decrease bleeding of active gum disease just by improving the gut microbiome. Improve the gut microbiome, you can improve the health microbiome. But you have a lot of other factors.
makes so much sense to me now. But I got to tell you that years ago I would just disagreed. I wouldn't have had any clue.
There are a lot of people that don't agree with me too,
Yeah.
and that's why it's such a controversial subject. But I think that's the answer.
I open my lectures that 99% of regular dentists aren't going to agree with anything I'm saying. So let's take a look at these 99% of your dentists and look at their mouths. How many have active periodontal disease? I would say close to 99%. You would know.
I would know because I've seen them. Yeah. So,
we have 3.5 minutes left.
Okay.
But can you tell us how to clean our mouth?
Yes. So here's the best way to clean your mouth. And I have a paper that is simple that I'll send you, and you can send to anybody and everybody that wants to see it.
Great.
Basically, you're going to use a soft bristle toothbrush, getting into the gum space where the gum meets the tooth, kind of like at a 45-degree angle. Gently brush in a horizontal fashion. You don't want to scrub hard because you don't have to scrub hard to remove excess dental plaque. You can use just water. You can dip your toothbrush in a little bit of coconut oil and then a little bit of baking soda. That will help. Baking soda is good. It cleans a little bit stains in the tooth. It's not very abrasive, just slightly abrasive, but also it helps maintain a pH level which is more normal and balanced. You can clean with that, or like I said, just water. You can clean the between surfaces of the teeth with a little device that is like a baby brush, but it's very, very tiny. The best brush that I like is called TP, T-E-P-E. You can get it on Amazon. It looks like a very, very small toothpick that has many, many fibers of silicone that scrub clean. It's latex free, and it will remove the excess plaque where the tooth meets the gum between the teeth. You can use the dental floss, but you should use the floss just to clean out what's between the contacts of the teeth. You don't want to floss under the gum aggressively because you're going to cut the gum. So I never floss under the gum. That's an old concept that I don't think is supportive, and I think it's destructive. And then you want to brush your tongue. Sometimes there are anaerobic bacteria that overgrow on the top surface of your tongue, and you don't want to sterilize this because these anaerobic bacteria are critically important to do some chemical factors that improve your blood pressure. So you don't want to destroy this anaerobic bacteria, but to get the excess off your tongue, which is 80 to 90% of where odors come from, take a teaspoon, invert it, stick it back in your mouth at the top of the tongue until you're just about going to gag. Pull the spoon forward, and then the little milky white fluid is the excess bacteria. Do that a couple times in the morning, a couple times before you go to bed. The best time to clean your mouth is definitely before bed. Ideally, clean first thing in the morning, last thing at night. You're good to go.
Good to go. Well, you know what, Doctor? Thank you very much. And we're going to continue to do this. They're going to cut me off in about 45 seconds. So I just wanted to thank you. And, I would ask people to keep generating this questions, like a question pool, because we'll continue to address, and it's easier for us to address specific questions than to speak in generalities. But the point you made about oral bacteria and gut bacteria and the biome of our body is well taken, and nobody's talking about that stuff.
Well, they're not just relating it to what is causing something that causes something else. So yeah, we need to put it all together. Our body is, we're not an island unto itself. Whatever happens to one cell eventually happens to every cell in our body.
In the body.
You need to understand that.
Well, I hope to see you soon. We could do more of this.